pour expliquer vite fait, oui, c'est en anglais, mais il y aura des slides en français et n'hésitez pas après à poser des questions en français s'il y a quelque chose que vous n'avez pas compris ou que vous avez besoin d'explications en plus. Voilà. We live in a world obsessed with health. Of course, this is probably a debatable statement, but I think I want to start today with this because most of us, even though our world is obsessed with health, would have a really hard time giving a definition of it. What is health? Well, the definition that stuck around the longest is the WHO, or World Health Organization definition, given in 1948. And this definition states that health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And at the time I was given, this definition was pretty groundbreaking because it admitted that several aspects that make up our overall well-being can contribute to your health, and not just whether you have a virus or not. But as our conception of health has evolved, and the concept of health promotion has also been created, another part of the definition was added to the one given in 1948, and it states, from 1986, that health is the extent to which an individual or group is able to realize aspirations and satisfy needs, and to change or cope with the environment. Health is a resource for everyday life, not the objective of living. It is a positive concept, emphasizing social and personal resources, as well as physical capacities. Well, of course, again, these definitions are also debatable, and it should be pointed out that they reflect a certain kind of values, which are certainly not universal. But I wanted to start out with the second sentence from the definition from 1986. Health is a resource for everyday life, not the objective of living. Because you see, this conference today is on the topic of the future. And when I was younger, probably similarly to some of you, I viewed the future as a place that was like science fiction. We would be taking trips to outer space. Everything would be perfect and easy, and we would probably be able to live forever. And while I never probably truly thought that we were going to be immortal, I did think that our generation, would go on to have the longest and healthiest life of them all. And of course, with this in mind, it only seemed natural that we would spend so much energy, time, and resources on achieving this perfect health. But as time has gone so we were putting all this effort into health, and that's because it was going so well. And for a while, it really was. In my 22 years of life expectancy has risen from 65.5 years to 72.5 years globally. So it's risen from 65.5 years to 72.5 years globally. Smoking rates have dropped significantly. Antiretroviral treatment for HIV and AIDS has curbed the global AIDS epidemic largely. And access to reproductive health care has increased across the world, and this has helped millions of people, but mostly women. And all this was going well for a while, but recently I feel like it's not been going so well. Diseases that had been eradicated for years are coming back due to lack of vaccination. Reproductive health care is experiencing a new wave of regulation and sometimes even being banned. And the rates of people living with chronic illnesses keeps on rising. Even global life expectancy has started to decrease for the first time since the 1910s, when the Spanish influenza and World War I killed millions of people. So then, if not everything that has been promised to us is coming true, if we won't be living forever, why are we even trying? Why keep trying? Well, this is where this definition of health comes in. Because I don't think we should just give up on health. But we do need to rethink the way we go about it. We have now reached a kind of dead end. After many years of trying to use advances in health sciences to optimize our own individual health, we have realized this is not working. So we need to change things. We need to realize that beyond just optimizing our own health, we need to band together. And instead of seeing health as a means of as in and of itself, we need to start seeing it as a resource for everyday life. Let me give you 3 reasons why. The first reason is due to the fact that health is extremely hard to define. Moreover, it's really hard to draw a line between what it is exactly to be healthy and ill. For example, let's say you have a cold. Did you first become ill with this cold when you started sneezing? Or when you first contracted the bug that gave you the cold? Or when you stepped into the room where this bug was present? Pretty likely that your answer to this question is different to that of your neighbors. And of course, the reasoning of when or how you get a cold is pretty insignificant. But what about when this concerns illnesses that have more consequences than the common cold, or will last longer, or even conditions that may not be considered conditions at all, depending on its definition? Take in this case, BMI, body mass index. So in 1988, the US government changed its definition for overweight to include women with a BMI over 25 instead of 27, and men with a BMI over 26 instead of 28. Overnight, 29 million Americans became overweight. Similarly, at the beginning of the AIDS epidemic, HIV/AIDS was categorized in 3 tiers: HIV, ARC or AIDS-related complexes, and AIDS. However, there was a lot of pressure in the medical world to scratch the ARC tier entirely, because they did not want to lead to the conception that ARC was not as dangerous as AIDS itself. So, once the US Presidential Commission on AIDS changed its entire reports and only called all 3 tiers of AIDS, of HIV/AIDS, as AIDS. So, okay, these are all about illnesses, and it may be hard to see exactly why this is harmful, but then let's take the case of homosexuality. Not so long ago, we considered homosexuality a disease, and it took until the 1970s for it to be completely taken out of the DSM, the manual that psychologists use to diagnose people with mental illnesses. And of course, it's easy now to see how that may have been harmful. But the other 2 cases mentioned can also be harmful, because if you start referring to all 3 tiers of HIV/AIDS, that means so many more people are considered sick. And in fact, it led to travel bans on HIV-positive people in the 1980s that have been kept until very recently. The one in the US was only taken down by the Obama administration after 22 years in place. These are some of the practical consequences of being considered ill. Additionally, many people have been fired from their jobs for being HIV positive and disclosing this, although that kind of discrimination is illegal. And people who are overweight typically pay a higher rate on their life insurance. But more so than this issue, there's also the fact that trying to draw these distinctions between healthy and ill reinforce a sort of us versus them mentality we often have when it comes to health. And when you start classifying everyone who has HIV, ARC, or AIDS as sick, it's only a very small step from designating everyone who is in the risk groups for this illness as sick. You can also see this in a more recent example with the coronavirus. Because it emerged first in China, there are now travel bans going around, and we've also seen that people are seeing all Chinese, and by extension, debatably, all Asian people as sick. And this has led to renewed higher rates of racism. Well, so, what is the line then? How do we define who is healthy and who is sick? The reality is, we kind of can't. So, what happens then if we do believe that there is a distinction, and we keep trying to get behind that line that qualifies us as healthy? As they say, desperate times lead to desperate measures.
It was not uncommon a few months ago to go on Instagram, to get back to the topic of social media, and to see influencers advertising such things as flat tummy tea to their millions of followers. Thankfully, in September 2019, the platform banned advertisement for so-called miracle diets. However, this mentality, this philosophy is being sold to us everywhere we look. You go to a movie, the Marvel movies have been super popular lately, and there's a man on screen, he's shirtless, he looks great. Well, to get there, he probably hasn't drunk for about 2 days. You go on Netflix, you see Beyonce's documentary on her run at Coachella, and you see how she deprived herself for weeks or even months for 2 nights on stage, only a few months after giving birth. Or you turn on American TV and you see the show The Biggest Loser, that shows you contestants who are severely overweight, running on treadmills, passing out, doing all sorts of activities and feeling ill from it, and being told that this is good for them. Yes, they are suffering, you're being told, but at least they are thin or getting thinner. At least they are beautiful, and therefore, they must be healthy. Of course, this is pretty extreme. I think a lot of you in here are health professionals or going to be, and most of you and most health professionals in general probably don't prescribe such drastic measures to lose weight or get healthier. But if you do look at meta-studies that look at the effectivity of weight loss interventions, most of them, beyond drawing conclusions, mostly point at the lack of evidence. As it stands right now, we don't know a lot about how these work. Last year, I did a research project on an intervention in the Netherlands. It was a combined intervention combined lifestyle intervention for overweight and obesity. I did a scoping study where I looked at 70 articles and papers written over 10 years about this intervention. Of these, not a single one had looked at potential adverse outcomes of the intervention. That means that out of 70 people, 70 teams, that researched the way this intervention works and the way it could do good, not a single one looked at what could go wrong with it. And even the institution that is responsible for monitoring and evaluating public health interventions in the Netherlands admitted that unless the owner of the intervention themselves report potential adverse effects of an intervention, they won't evaluate them. So, what that means is that when we try to be healthy desperately and we forget to look at the consequences of our actions in those cases, well, what are we truly doing? Where is that going? And is that really the way we should be pursuing health? My third point on why we should be changing our conception of health is that one of the reasons we try so hard to be healthy is because we believe that health will bring you happiness, fulfillment, and value as a human being. Well, spoiler alert, just like I didn't really agree that in the first place you can draw a line between health and illness, or that we should pursue health recklessly, I also don't believe that health automatically leads to fulfillment. And one of the people who helped me realize this is one Claire Wineland. You can see her picture up there. Claire was born on April 10th, 1997, just about 6 months before me, and she was born with a disease called cystic fibrosis. She was born ill from a very young age. She was dealing with illness, and she started doing public speaking at a really young age. She did several TED Talks, and she also became a relatively well-known YouTuber. And when Claire spoke, she didn't speak asking for a cure for cystic fibrosis, although that would have been completely understandable. But most of the time, she spoke to her audiences about what it was like to grow up with a terminal illness, and what it was like to live with illness, and how this did not preclude her from living a good life. And one of the reasons I loved listening to Claire talk, other than she was a really funny person, was that her talks made me less afraid. They made me less afraid that if I ever were to get sick, I would just not be able to be happy. They made me less afraid of just living life. And Claire did not mean for people to not value their lives. She herself spent hours every day on treatment, breathing treatments, and other kinds of treatments for cystic fibrosis. But she did want to tell them that you should not just live to be healthy. You should be healthy to a certain degree to live. And also, that people who are not healthy can be happy, as she was, because there are good times and bad times, regardless of your health status. Unfortunately, Claire did pass away from stroke resulting from a lung transplant in August 2018. But I think she's left behind a really long legacy, and she's definitely impacted the way I think about health. Now, I hope I've taken you through sort of a journey of how my conception of health has changed over time, and why I think that we should go from this conception of health is something we need to strive for desperately to something that we just need to take into account in our lives, but not chase. And that is because, one, it's extremely hard to draw a line between health and illness. Two, when we do try to get behind that line desperately, it leads us to act in ways that we don't understand the true consequences of. And three, that we can be fulfilled, even though we are not necessarily happy. That we can be fulfilled even though we are not healthy, and that health does not automatically lead to fulfillment. So now, if I've taken you on this journey in a bright way, then the question is, what do we do now? Where do we go from here? Do we reinvest all that time, money, and energy we've put into health into some other area of our lives? Well, not necessarily. But I do think it's time to finally live up to the definition of health given to us in the 1986 by the WHO. And to go from an individual responsibility for a collective definition of health to a collective responsibility to enable individual definitions of health. I'll let that sink in for a second if you want to read it in French as well. So, collective responsibility for individual definition of health. I think that quite a few of the issues we're facing right now in public health could be helped if we had this new definition. Because sure, this is less sexy than immortality, but ultimately, it's also less devastating. And it doesn't preclude from the start, this definition of health, it does not preclude from the start the millions of people who are living with chronic illnesses from being happy and from being, in a sense, healthy. So, what can we do about this? Well, there's already quite a few people doing things as we speak about this. For example, Claire herself started a foundation while she was alive that helps families with kids who have CF pay their bills, medical and otherwise, while dealing with all the strain of having a kid with illness. And before she or I were even born, AIDS activists fought for decades and years to give fairer and easier access to medicine. And their techniques to do so are still being used today by other communities, such as the people with diabetes, in their fight for affordable and accessible insulin. Now, there are many other concepts and many other people I would have loved to introduce to you here today, because the truth is, of course, I'm not the first one to say this, nor am I the one to say it the best, but I'm the one telling it here today. And I hope that that's enough to inspire you to seek out more of this and to think about this for yourself. We are a society obsessed with health. And the truth is, that's probably going to stay that way because our populations are aging and because also of many other factors. But if we are obsessed with health, then I think we should be thinking critically about it, thinking critically about why we value health so much. And when we pursue it, we should be pursuing it in a way that unites us instead of dividing us. Thank you.